Missing most of your teeth? Full mouth implants in Medellin could be an affordable option. But what's the process? Which type should you get? We went directly to Medellin's top dentists for an explanation with actual case studies.
I do dental implants, that is placing a titanium screw on your jawbone to replace a missing tooth. And we can use it for single tooth or for multiple units when a patient doesn't have any tooth at all. It can be over 4, 6, depending on the patient. To do that kind of treatment, we call it a full arch. In that case, the patient will have to stay here at least from 10 days to 2 weeks, okay? Because if the patient has teeth that needs to be removed, in that case, we need to do a first surgery where we remove those teeth and we place the implant. If we have a good quality of bone and the torque of the implants, that is the strength of the bone, is very good, we could load the implants on that same tree. Okay, when we have a full arch and the implants are and the strength of the bone is very good, we could load those implants and do a temporary prosthesis that the patient can use during 6 months and it will be fit. Okay? And after those 6 months, the patient can come back and we change that prosthesis for the definitive one. In that case, we can do something called a bone graft, that it's placing some particles of bone in the gap that is generated after the extraction, and we need that bone graft to heal for about 6 months. And then the patient would have to come back to place the implant, and in that case, he would need at least 3 visits, because on the 3rd visit, we will do the crown of the implant.
How do you decide if you want to have individual implants are better or 4 implants with a hybrid bridge? Which one? How do you decide that?
Planification is very important. I need to organize the different the pictures, the x-rays, the exam, clinical exam, and analyze what is the best option for the patient. For example, this is 1 by 1.
So what is this?
This is 1 by 1.
Okay, individual
crowns. This is the bar, and in the bar, the laboratory designed the post.
So that's a bridge on top of a...
Yes.
How many implants?
In this case, the patient had 6 implants.
Okay, so this is a bar with ceramic crowns.
All ceramic crowns.
All ceramic crowns.
Yes, all ceramic crowns. Because another option is metal ceramic crowns. And this is the difference. For example, in this case, I designed only 1 piece in zirconia.
Okay, so this is 1 piece in zirconia.
Yes, this is the final aesthetic. For example, here are the implants, and between is the bar, but everything is only 1 piece.
6 implants.
Yeah.
And then the 6 implants have a bridge on top of them, zirconia.
Another point is that I explained that the patient have 2 options or more options, and the patient decides the base of the money, the time. But for example, always I prefer more implants if it's possible. The technique on 4 is famous, UX, but I prefer if it's possible to use more implants. I prefer more implants. Why? Because if the patient only had 4 and lost 1 implant, it's necessary to remove all. For example, if the patient have 5 or 6 implants, have more support, divide more the effort in the mouth, and if he lost 1 implant, I use the rest of the implant, and it's not necessary to change all the crowns, all the restoration. It depends on the analysis, is the decision. But always I explain to the patient with pictures, with models, and it is possible with the crowns that the patient analyze what is the best quality.
Wondering why patients love to visit Colombia? A top dentist explains it here.
Get a great smile with Dentification. Visit a hand-picked dental clinic today.